So today we will be presenting on the health of young children and adolescents. The health of a child is important, but before we go any further, I'd like to clarify the stages of early childhood by age range. A neonatal infant or a newborn, as seen in the picture, is a baby's first 28 days of life. An infant is roughly the first month to 11 months of life, and a toddler refers to ages 1 to age 4. So a child's development stages of early childhood actually begin before conception with their parents' health and their predisposing genetic traits, and development continues through the prenatal period. Their exponential growth during early childhood from newborns to toddlers doesn't compare to any sort of growth later on in life. So from a health standpoint, young children's well-being concerns growth and development to achieve their full potential as healthy adults. In other words, health is central to a child's development. So hookworm, asphyxia, polio, sepsis, tetanus, meningitis, protein energy malnutrition, preterm birth complications, congenital birth defects, and communicable diseases are just some of the leading morbid diseases that result fatally to young children. In 2017 alone, 5.4 million children under the age of 5 died around the world. 2.5 million of them were neonatal infants, 1.5 million were infants, and 1.4 million were toddlers, again, all of which were under the age of 5. A mere 2 years later, in 2019, the statistics slightly decreased to 5.2 million children around the world, 90% of which belong to low or middle income families. It's also interesting that most of the diseases listed down to the right are all preventable and treatable bacteria, viruses, and fungi that could be diagnosed and treated with antibiotics or early detection at the community level. So the diagram to the right is from 2016. It indicates the number of deaths per 1,000 live births and is differentiated based on region. Sub-Saharan Africa especially has the highest neonatal and infant mortality rates than any other region. Collectively, a child who is born into a low-income country has a greater chance of dying than a child from a high-income country. In recent years, the World Health Organization has found some factors that contribute to children living health-compromised lives, and in the worst-case scenario, shorten their life. They include income, education, and location. While most healthy children can fight off infection, children whose immune system is compromised by undernutrition, not being breastfed the first 6 months of life, or developing one of the previously mentioned diseases, those children have a harder time fighting off infections. Unfortunately, money talks, and rural regions of Sub-Saharan Africa, Latin America, South Asia, and the Caribbean are twice as likely to die before their 5th birthday compared to their urban, high-income counterparts. On the flip side of things, fortunately, the risk of dying decreases with age, meaning that the riskiest are the first hours, days, weeks, and months of a young child's life. Once they can get past that, their odds of living are better.
The costs and consequences of child morbidity and mortality are split between short-term costs, medium, and long-term costs, as well as social costs. There are direct losses in productivity that relate immediately to the morbidity and mortality of young children that cannot be measured. However, the costs and consequences of these illnesses are enormous. The direct and indirect costs of caring for a sick child are extremely high. This is because caregivers devote special attention to the child who is ill, and this prevents them from engaging in income-earning activities. The average child in Africa is infected with malaria every 40 days. That's about 9 cases every year per child. The average child in low and middle income countries will get 3 to 6 cases per year of acute respiratory infection and 2 to 3 cases of diarrhea. For these reasons, families spend a large amount of their limited financial resources on buying medical care for a sick child. Problems associated with prematurity, low birth rate, intrauterine growth resection, and congenital abnormalities have the possibility of leading to permanent disability. This not only affects the child, but families and society. In Brazil, a study concluded over intelligence test scores was 25 to 65% lower in children that had a history of persistent diarrhea. The drop in the scores can be attributed to a child missing a large quantity of school. Measles also presents many issues as it can lead to encephalitis and blindness. This can cause anemia, growth restriction, and the slowing of mental development, which in turn reduces children's attendance and enrollment, as well as their performance in school, and can have a great consequence for later productivity. Many families in low-income countries often overcompensate with very high fertility as they know their chances of their newborn or young child dying is high, in hopes of ensuring that the number of children they want will survive. Women have more children than they would want to otherwise. This can lead to miscarriages and a range of health issues for the mother. Immunization is one of the most successful and cost-effective child health interventions available. National immunization programs are essential to reduce children under the age of 5's morbidity and mortality rates globally. Each year, routine immunization prevents between 2 million and 3 million deaths and protects up to 100 million people against illness and disability. There are a huge range of direct and indirect benefits. Direct benefits include the prevention of illness in immunized individuals, reducing the whole cost of the immunizations a person would face if they fell ill from the disease from which they are immunized, and preventing the loss of productivity of the ill person and people who have to care for them. Indirect benefits of immunization are quite extensive. By preventing illnesses, vaccines contribute to healthy child development and higher cognitive skills, and the child with reducing losses in productivity later in life. In reducing healthcare costs, immunization allows families to save and invest money, which encourages broader economic and social development. The term herd immunity is well known, especially in regard to COVID-19, but herd immunity is also extremely important within within all immunizations globally and has been for some time. Herd immunity refers to vaccines protecting the health of unvaccinated people as it helps their health, economic, and social benefits. Routine immunization generates economic benefits that derive from both productive human capital and from medical costs averted by preventing diseases. For example, 72 of the poorest countries could save 6.4 million lives, avert 6.2 billion in treatment costs, and 145 billion in productivity losses between 2011 and 2020. There have been many efforts within the international community to develop a variety of programs and initiatives that promote child health or immunizations. In 1974, the World Health Organization launched the Expanded Program on Immunization, or EPI. The EPI's objective was to vaccinate children throughout the world. In its first phase, EPI focused on 6 diseases: tuberculosis, polio, diphtheria, tetanus, whooping cough, and measles. The EPI recommended vaccines on all eligible children from birth to 12 months of age. In 1974, only about 5% of the world's children were vaccinated against the 6 diseases. EPI stood alone for about 20 to 30 years, but around the year 2000, scientific advances in vaccines opened up new doors. In addition to the original 6 diseases, the EPI set out to vaccinate people against rubella, hepatitis B, Haemophilus influenza B, also known as Hib, rotavirus, pneumococcal pneumonia, and HPV. These were all introduced in global vaccinations. Antigens to protect against these diseases are now included in a range of different vaccine combinations that is called the pentavalent vaccine, which has antigens against 5 childhood diseases: diphtheria, tetanus, whooping cough, hepatitis, and Hib. The World Health Organization recommends for all children to be vaccinated against tuberculosis, hepatitis B, polio, pneumonia, pneumococcal disease, diarrhea, measles, rubella, and HPV. They are also recommended diseases for children residing in certain regions such as Japanese encephalitis, yellow fever, and encephalitis. The Global Vaccine Action Plan is a strategic document for global vaccine efforts. It was launched in 2011 and covered up until last year in 2020. The Global Vaccine Action Plans build upon the success of earlier efforts and seek to achieve key milestones in discovery. development, and delivery of life-saving vaccines to the world's most vulnerable populations. All of the efforts regarding vaccines and global vaccination must be financed from somewhere. Many low and middle income countries need financial assistance to help with the cost of the national immunization programs. Therefore, in 1977, the Pan American Health Organization was created as a revolving fund for vaccine procurement. The fund was pooled with resources from over 40 countries and allowed these countries to bargain as a group to buy large quantities of high quality vaccines, syringes, and related supplies for the lowest possible price. They were also able to distribute them among individual countries. America has this system to thank for the tens of millions of children that have been vaccinated against preventable diseases. The Global Alliance for Vaccines and Immunization, known as Gavi, was established in 2000. The aim of Gavi is to address a large number of children globally who are still not vaccinated from the 6 basic antigens, as well as to deal with exceptionally slow pace that many low-income countries adopted for the newer vaccine. Gavi was able to come to life thanks to the $750 million grant from the Bill and Melinda Gates Foundation. Gavi is a public-private partnership that works to promote and strengthen immunization programs of low and middle-income countries. It assists in financing procurement for vaccines and related supplies, as well as strengthening the capacity to deliver vaccines to those who need them in a timely, high quality, and sustainable manner. A study of Gavi estimated that for every dollar spent on immunizations, $18 is saved in healthcare costs, low wages, and lost productivity due to illness. The estimated return has rose to $48 per $1, taking into account the benefits of people living longer and healthier lives. There have been amazing progress in global immunizations, such as the number of under-vaccinated children fell by 1.8 million between 2000 and 2017. More children received the DTP3 than ever. Globally, 88% of the world's children are immunized with BCG against tuberculosis. And Haiti was also able to achieve elimination of neonatal tetanus, making the Americans free of neonatal tetanus as well. The WHO Western Pacific region achieved its lowest level of measles incidence, and 2 countries have eliminated rubella. The Africa region has expanded funding by immunization by 130% from 2010. And this is extremely important as Africa has risen in the amount of children under the age of 5. Despite enormous progress and expanding coverage of the recommended vaccines, there's still a number of critical gaps in achieving universal coverage, such as 19.9 million children were under-vaccinated in 2017. Only 1 WHO region is free of rubella at this time. Measles incidence increased from 19 cases per million to 25 cases per million globally, as well as new vaccine introductions are at risk of stalling. Besides the gaps in coverage, there are also just critical challenges in general to achieving universal vaccine coverage, such as vaccine hesitancy, the fragility of gains by an achieved date, national ownership and commitment, the financing of immunization in middle and low income countries, as well as gaps in equity and the coverage of the most difficult to reach areas. The Pan American Health Organization launched a program to eradicate polio from Latin America and the Caribbean. Thousands of health workers, managers, and technicians were trying to implement a strategy for the eradication of polio. This included reaching every child of oral polio vaccination, identification of new cases, and aggressive control of any outbreaks. If polio was to be eradicated, the campaign against it would be built on the lessons learned from the smallpox eradication campaign. There was a huge impact from this campaign, as the last case of polio in Latin America and the Caribbean region was reported in Peru in 1991. However, polio did reemerge briefly in the year 2000, with 20 new cases reported in Haiti and the Dominican Republic. But no new cases have been reported since 2000. This is quite exponential considering there has been no reports in the last 20 years. The polio campaign in Latin America and the Caribbean cost around $120 million in its first 5 years, $74 million from national sources, and $46 million from the international donors, as well as an annual $10 million from donor sources thereafter. The investment paid for itself in only 15 years. The success of eliminating polio from Latin America and the Caribbean took only 6 years and was the result of exemplary political commitment. Measles was the ninth largest killer of children under 5 years of age globally in 2016. Since measles is a highly contagious viral disease, in the absence of being vaccinated, about 90% of those who are exposed to the virus will contract measles. The measles vaccine is safe, effective, and inexpensive. It costs less than $1 to purchase and deliver. Despite the availability of a safe and cost-effective vaccine, only about 15% of children receive the first dose. Measles is most occurring in low and middle income countries such as sub-Saharan Africa, East Asia, and the Pacific, as well as South Asia. With 95% of measles-related deaths occurring in low-income countries, death rates for measles can reach up to 10%, where undernutrition and poor health are most occurring. There was an outbreak of measles in the Americas in 2017. This was related to the economic chaos and decline of the health system in Venezuela that spread to Brazil, Ecuador, Colombia, and Peru. Finally, a vitamin A deficiency compromises the immune system of nearly 40% of the children in low and middle income countries and leads to almost 1 million deaths each year. Vitamin A deficiency is extremely prevalent in Nepal. This is because difficult terrain made it hard to grow and access types of food that supply vitamin A, and 30% of the Nepali population live in absolute poverty, many of whom are socially excluded lower class families who frequently lack the means to pay for nutritious foods. In 1992, the Nepali Ministry of Health initiated a plan to take on the vitamin A deficiency. Even the King of Nepal demonstrated long-term commitment to his effort by incorporating Nepal's national vitamin A program into the 10-year national program of action. This program aimed to reduce child morbidity and mortality rates by prophylactic supplementation of high-dose vitamin A capsules to children 6 to 60 months of age, twice each year. However, the Nepali public health system faced immense problems at the time of vitamin A implementation. An evaluation of the program indicated that the under 5 mortality decreased by around 48 deaths per 1,000 births, and 134,000 deaths were averted between mid-1995 and mid-2000 as a result of Nepal's vitamin A program. With all of the important progress in the last 30 years in regard to reducing morbidity and mortality rate of children under the age of 5, there are still key challenges regarding child health. There are substantial challenges that still remain in many low and middle income countries. First, much less progress has been made introducing neonatal deaths than preventing post-neonatal deaths. Second, progress and reducing child death has remained insufficient in the 2 regions with the highest rate of such deaths, which are Sub-Saharan Africa and South Asia. Given the demographic patterns, Sub-Saharan Africa is the only region with more under 5 children than they had in 1990. And this is also the region where progress in reducing the under 5 mortality rate has been the slowest. There are many interventions that are known to be low cost and effective at reducing morbidity and mortality rate in young children that are not being implemented where they are most needed. For example, many mothers and mothers are not well nourished and are not receiving appropriate prenatal care. A large number of births in low income countries take place without the help of a skilled birth attendant who can assist a mother and, for example, resuscitate the baby if needed. A large proportion of neonatal deaths in low and middle income countries can be avoided with simple technologies that can be effectively implemented in low income settings. Almost 2/3 of child's deaths that occur every year can be prevented by effective implementation of measures such as these that are both low cost and effective. However, important gaps still remain, such as addressing the social determinants of poor child health and many of the key risk factors, such as nutrition, water, sanitation, hygiene, and education. Key interventions along the life course, including ensuring a healthy and well-nourished mother, prenatal care, micronutrient supplementation for the mother, prevention of the mother transmitting HIV to the child, attendance at delivery by a skilled birth attendant, and referral for emergency obstructive care if needed, appropriate care of the newborn and referral if needed for illness, early and exclusive breastfeeding of 6 months, hygienic introduction of diverse complementary foods, childhood immunization, bed nets for malaria and regular drug administration for worms, and oral rehydration for diarrhea, as well as early diagnosis and treatment of pneumonia. As you can tell, these key interventions start at mother to mother, newborn, and managing diseases in infants and young children. These goals are to protect, prevent, and treat children. That way their health has the best chance it can. And now Andrea will lead us into discussing the health of adolescents and young adults.
Health. As stated in the textbook, Adolescent and young adults make up around 24% of the world's population. Most of the time, individuals who are between this age range are generally healthy. However, some suffer from mental health, substance abuse, nutrition, and weight. Since this age range is considered developmental stage, health during this time is crucial. Individuals are influenced by peer, parent, and environment. Now, why is it important for adolescent young adults to be healthy? At this age, young adults also go through economic challenges and are obligated to take a more responsible role. Also, young adults who are African American, American Indian, or Latino experience the worst outcome compared to other races. They experience obesity, unintended pregnancy, and education achievement. It is highly important for young adults to be physical and mentally healthy because our teenage years help shape our personalities for adulthood. Data on health in adolescents and young adults. Sources come from World Health Organization. Young adults that fall under ages 10 to 14 years have the lowest risk of death of all ages. 50% of mental health disorders start at around age 14. However, most are undiagnosed. Globally, there are 43 births per 1,000 to girls aged 15 through 19 years per year. The leading cause of death among young adults include injuries, traffic accidents, drowning, and self-harm. Multiple physical and emotional and social changes are occurring during these years. Most teenagers who are suffering from poverty, abuse, or violence are more vulnerable to mental health issues. That's why 50% of mental health disorders usually start around the teenage years. Child and adolescence as a transitional and critical periods. As mentioned in the Cleveland Clinic, individuals who are entering the stages of adolescence go through many changes mentally, physically, and emotionally. I will first be talking about the physical changes. So the growth spurt would be the first indication, and then comes the primary and secondary sex characteristics. Examples include pubic hair, enlarged breasts, and females usually tend to get wider hips while males get deeper voices. Intellectual changes. During this time in an individual's life, they begin to wonder why something might be true rather than just logical thinking. Young adults are now able to see abstracts and see many possibilities. However, during this stage, young adults still tend to think more about themselves. Now, the emotional changes. During young adult phase, teenagers begin to search for their identity. This is why these years are important because it shapes a teenage perception and belonging to the world.
Key health burdens in adolescence and young adult health can be caused by early pregnancy and childbirth due to maternal causes in females ages 15 to 19. Pregnancy can be deadly to adolescents in low-income countries because they may be undernourished and gave birth at young ages where health services are weak. Anemia is rampant in low and middle-income regions in 10 to 14-year-olds. Also, anemia is the leading cause of DALYs among males and females aged 10 to 14 globally. HIV/AIDS related deaths among adolescents are increasing in some African regions. In some countries, up to 60% of new HIV infections happen in 15 to 24-year-olds because that's when most people become sexually active. Mental health is a fundamental issue for adolescents and young adults, and it affects 10 to 20% of all adolescents. Transport injuries are the third leading cause of death among those aged 15 to 19 and second among 20 to 24-year-olds. Interpersonal violence is the leading cause of adolescent mortality and results in 180 deaths every day. Economic and social consequences. Economic consequences can be maintaining the health of adolescents because they live in low-income countries where they can't afford health care. Tuberculosis is a major cause of death among adolescents in Africa and causes months of lost work since they become strained economically and they can't provide they can't afford to pay for health care. Also, they can't afford to pay to further their education. Some social consequences are adolescent pregnancy can lower the chances that a girl will complete her schooling and that her child will go on to get a good education. People who take up smoking, drinking, and doing illegal drugs start during adolescence and usually is hard to stop, and it can have a permanent effect in many adolescents. Improving the health in low and middle income countries. Programs that enhance the health of adolescents need to be intersectoral to make sure it covers things from road traffic injuries to interpersonal violence. The adoption of universal health care can be beneficial because health systems can reduce the barriers to care that many adolescents and young adults face. Also, making healthcare more appealing to adolescents, and, which can encourage them to seek care. Working towards reducing the new HIV infections among adolescents will have to take into account the risks that alcohol and substance abuse pose for unsafe sexual practices. They also have to implement the World Health Organization guidelines to help young adults that are struggling health-wise with tobacco use or alcohol abuse.